Hi, my name is Abby. I'm a Harvard College nursing student. Is it okay if I do a head-to-toe assessment on you today?
Yes.
Okay, so I've provided patient privacy. So can you give me your first and last name and date of birth?
Brianna Lucero, April 20th, 1993.
Okay, and do you know where you are?
At Harvard College.
And why are you here?
So you can practice on me.
Okay, and then can you tell me the date?
April 17th, 2017.
Okay, so patient is alert and orientate times 4. Person, place, time, and situation. And then she is responsive, and she seems like in a pleasant mood. And then, so I know that the airway is patent because she's responding. Her breathing seems unlabored. She doesn't seem short of breath. She's sitting up straight. And then no nostril flaring. So I know breathing is okay. And then circulation, her skin looks normal. And then no cyanosis, pallor. So before this, we did her height and weight, which she's 5'4", and she weighs 150 pounds. And then we calculated the BMI index, which was 25.7. We took her vital signs, which was 120/80 for her blood pressure, 70 for her heart rate, 14 respirations a minute, and then temperature was 98.6, and oxygen was 100% at room air. And then we also did the Snellen chart for cranial nerve number 2. Her vision is 20/20 for both eyes. Okay, so first I'm just going to go ahead and start with your face. Okay, so just go ahead and look straight at me. And I see that her eyebrows, her eyes, her mouth, and her ears are all symmetrical. And then her nose is midline. So then I'm just going to go ahead and touch your head. Is that okay?
Yeah.
Okay, so I'm just feeling for any bumps, lesions, and then do you feel any pain? Okay, and then I'm just going to go ahead and touch your ear bone here. Okay, skin looks intact and no exits secretions. Any pain in your ear?
No.
Okay, while I'm there, I'm just going to go ahead and do a whisper test for cranial nerve 8. So can you just repeat what I'm saying?
Red dress.
Okay.
Blue car.
Okay, so cranial nerve number 8 is good. And then I'm just going to touch your nose. Any pain or tenderness?
No.
Okay, so it's midline, no pain or tenderness. And if you could just cover one nostril and then blow it out. And then the other one. Okay, did you have any difficulty at all?
No.
Okay, so both nostrils are patent. And then if you could just follow my finger. Okay, so that was cranial nerve 3, 4, and 6, so cardinal gazes and accommodation. And then I see that her sclera is clear, so it's white. And then I'm just going to take a look at the conjunctival sacs. So it's pink and moist, so that means you're well hydrated. And then I'm just going to have you close one eye for me. And then I would dim the lights. Okay, and then the other eye. Okay, so then I would compare both pupils and say that pupils are equal, reactive to light, rounded, and accommodate. So then I'm going to check the inside of your mouth. So if you could go ahead and say "ah" for me. Okay, so I see that her uvula and the palate rise, and then I'm just going to take a look and then see that she's got all teeth, the tonsils are not enlarged, and then it's pink and moist. The top of her tongue is rough and pink, and then the bottom is venous, veiny, and glossy. Okay, and then can you stick out your tongue for me? Okay, so it's midline, so it's cranial nerve 12. And then I'm just going to go ahead and touch the glands, okay? So I've got the parotid, and then salivary, and then thyroid. So they're not enlarged. And then I'm going to do your lymph nodes, okay? So I've got the preauricular, the postauricular, the occipital, and I've got the submental, the submandibular, and then I've got the jugular digastric,
higher, like
and then
more
I've got
risk.
the superficial
I went to
cervical,
Lutheran because
the
I was
deep cervical,
older.
and then the post-cervical.
And unfortunately, I
and
needed,
the
and I was
supraclavicular.
left.
So they're not enlarged.
Yeah.
And the frontal and the sinuses. So I've got the maxillary sinus. Do you feel any pain or pressure? Okay. And then your frontal pain or pressure. Okay. So both sinuses, so no infection or anything. And then I'm gonna do your upper extremities. So do you feel any? Okay. The skin is warm and dry, and then I was checking for bruises, lesions, or messes. So capillary refill for both is less than 3 seconds. The circulation is good. Then I'm going to check the radial pulses.
They're answer buzzers. Yeah, if you can unpack it and then just make sure it's
They're equal +2 for both.
batteries. I just
And then I'm just going to do some range of motion. Okay? And before I do that, I'm going to check the profile sign of the finger. Okay, so 160 is greater for both. And then, so we're just going to do some range of motion, okay? So just go ahead and follow me. So go up, and then down to your back, and then go up, and then back down, and then go up, and then just turn back. Okay, and then move your hands in, up, open, straight, and then just your fingers. Okay, and then go ahead and pull. Okay, and then push. Okay, and then go ahead and flex for me, okay? Okay, so strength and range of motion is good. And then I'm going to go ahead and move down to your chest. Okay, so if you could go ahead and lay down for me. Here's lung sounds, and then I'm going to stop at the apex of your heart and listen for a minute, okay? So just take a deep breath every time I move my stethoscope. Okay, I'm going to listen to the apex of your heart, okay? So just breathe normally. Okay, so I would be listening for a minute, and then her heart rate is 70, and then I would be listening for an S1 and S2, which are present. I don't hear any extra sounds or clicks or murmurs. And then I'm just going to listen to your valves, okay? So I've got the aortic valve. Okay, I hear an S1 and S2, and then pulmonic. Okay, S1 and S2, and then it'd be tricuspid. Okay, S1 and S2, and then the mitral. Okay, S1 and S2, and then I would do the same with the valve of my stethoscope. Let's say aortic, S1, S2. Pulmonic, S1 and S2. Okay, tricuspid, S1 and S2. And then the mitral, S1 and S2. I didn't hear any extra murmurs, clicks, or sounds. And then if you could clean up for me, I'm just going to go ahead and listen to the back of your lungs, okay?
Okay.
So take a deep breath. And if you could just go ahead and lift up your arm. Another deep breath. Okay, and then on your other side in just 2 spots. bronchiovesicular, vesicular breath sounds were clear. No diminished lung sounds. So then I'm going to have you lay back down, and then I'm just going to take a look at your abdomen. If you can lift up your shirt, please. So first I'm just inspecting. So I'm going to check for any pulsations of the aorta from each side of the bed. So I see small palpitations here, which is normal. And then I don't see any bruises or scars or anything. Have you ever had surgery in your abdomen? And then do you feel any pain in any region? No? Okay, so first I'm just going to go ahead and listen to your bowel sounds. Okay, so bowel sounds are present in all 4 quadrants. While I'm here, I'm going to take a listen to your aortic and I'll listen with the bell of my stethoscope. So I could hear the aortic artery, but not the renal, which is okay in adults sometimes. And then I'm just going to go ahead and touch your abdomen. Is that okay? So do you feel any pain or tenderness? No.
Ladies look like hearts.
Any pain or tenderness anywhere? Okay, so now I'm going to push down a little harder, okay? I'm using a circular motion to feel for any enlarged organs. And then just let me know if you feel any pain or tenderness anywhere. Okay, so I did notice that the abdomen is flat and rounded, and then she's got an innie, and she does have a piercing on the umbilicus, but it doesn't look inflamed or affected, so that's good. So you can go ahead and put your shirt back on. Okay. So then I'm going to move down to your lower extremities, okay? So can you feel my hands?
Yes.
Okay. So I would be inspecting for any bruises, lesions. So she's got a little scratch right here. Is this healing well?
Yes.
Yes. Okay. And then I'm going to check capillary refilling. Okay. So less than 3 seconds for both. And then her skin was warm or it was actually kind of cool. So cool and dry. And then I didn't see any other lesions. And then I'm just going to have you point your toes up, and then against the distance. Okay, and then I'm going to check your pedal pulses. Okay, so pedal pulses are equal. I would say a +2 for both as well. And then no edema at either extremities. And then I'm going to do some range of motion exercises for your hips. So if you could go ahead and lift this foot up and then back down, and then flex your knee. Okay, and then move it to the side, towards the inside. Okay, go ahead and extend your foot again, and then extend your foot off the bed for 5 seconds. Okay, back in. And then I'll go ahead and go against my hand. Against my hand. Okay, Okay, so that was for strength. Then we're going to do the same with the other foot. So go ahead and go up, and then back down. Flex the knee, and then go out, and then in, and then go ahead and extend your foot, and then your leg out of the bed for 5 seconds. And then back down. Okay, and then against resistance. So strength and range of motion are good. And then I'm going to go ahead and do the Babinski test. So if you could just, there you go. Okay. Okay, so if your feet curled, which is normal, and then I'm going to go ahead and sit up on the edge of the bed for me. Okay, so first we're going to do the reflexes. Okay, so I got reflexes on both, and then for the brachial, or the okay, so your fingers curled a little, and then on this side. Okay, so both her reflexes are good. Okay, and then I'm just going to go ahead and do like a sensory test, okay? So I'm going to touch you with the cotton swab and just tell me when you feel it by saying no. Okay, so go ahead and close your eyes. Okay, and then I'm going to do a sharp versus dull. So this is going to be the soft, or the dull, and then this is going to be your sharp. Okay? Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Dull? Yes. Okay, so that was a sharp versus dull. And then we're going to go ahead and test your cerebellar function. So go ahead and you do your nose to my finger, okay? Okay, and then I'm going to have you stand up for me. And then I'm just going to have you walk like you would normally. And then back. Okay, and then I'm going to have you do heel to toe. Okay, so then I'm just going to have you stand still, okay, and then I'll just close your eyes, okay? I would do this for 20 seconds, and she's swaying a little, but not too much. Okay, and then if you could just, you can go ahead and open your eyes. So then I'm just going to take a look at your spine. So I see that it's midline. Do you have any pain anywhere? No. Okay, so I see that it is concave on the cervical spine, convex on the thoracic, and then concave on the lumbar. And then if you can go ahead and bend down for me. Okay, so she's got a C, so that's good. And then go ahead and stand back up. Okay, and then you can go ahead and face me. Okay, and then I'm just going to do range of motion for your spine. So go to one side, and then to the other side. Okay, and then keeping your hips still, go ahead and turn. Turn. Okay, so range of motion is good. Okay, so go ahead and sit back down for me. Okay, and then we're going to do the range of motion of your neck, okay? So go ahead and look up for me, and then down, and then then to your left, and then to your right, and then go against my hand, and then against my hand. So that's cranial nerve 11. And then also I'm going to check for jugular vein distension. So go ahead and lay down for me. So the bed is at 30 degrees, and then I just need you to look to the side for me. So I'm looking for the triangle, and I don't see any distension. And then on the other side, I look for the triangle and no distension. Okay, very good. And then I'm going to just take a listen, okay? Okay. So actually, first I'm going to feel your carotid pulse. This time. Now I'm going to listen with the belt on the stethoscope. Okay, so I don't feel any breeze. Good. Okay, so that concludes our hepatitis assessment. Do you have any questions for me?
No.
Thank you. Thank you.